What if the dry eyes you've been blaming on too much screen time, or the constant fatigue you thought was just aging, were actually early warnings of something far more serious? Sjögren's syndrome is a silent autoimmune disease that often hides in plain sight. It starts subtly: dry mouth, tired joints, maybe a little brain fog, and most people ignore it, thinking it's nothing. But behind those mild symptoms, your immune system may already be attacking your body from the inside out. Left untreated, Sjögren's can damage your eyes, your nerves, your lungs, even your internal organs. The most frightening part? Many people go years before getting diagnosed. Why? Because the signs often mimic normal aging or get brushed off as side effects of stress, menopause, or medication. But here's the truth. Catching Sjögren's early can protect your quality of life. It can mean saving your vision, protecting your voice, preserving your energy, and avoiding complications that are far harder to treat later on. In this video, we'll walk through 10 of the most important symptoms of Sjögren's you should never ignore, especially if you're over 50. These warning signs may be subtle, but recognizing them now could make all the difference later. If you or someone you love has been dealing with unexplained fatigue, recurring dry eyes, or strange joint pain, this video is for you. Let's uncover what your body might be trying to tell you before it's too late. 1. Dry eyes that don't go away? It could be Sjögren's. At first, it might just feel like your eyes are a little scratchy in the morning. Maybe you've been blaming it on too much reading, screen time, or even the weather. You might reach for artificial tears, think it's just seasonal dryness, and move on. But here's what most people don't realize. Dry eyes are often the first visible warning sign of Sjögren's syndrome. Unlike typical eye dryness, Sjögren's related dryness comes from within. Your body's immune system begins attacking the glands that produce moisture, especially the tear glands. Over time, your eyes stop making enough tears to keep themselves lubricated. This leads to a burning, gritty, or stinging sensation. Some people describe it as feeling like they have sand in their eyes all the time. The problem doesn't stop with discomfort. Without enough moisture, your eyes are more vulnerable to damage. Tiny scratches can develop on the cornea. Infections become more frequent. Vision can begin to blur, and light sensitivity increases. If left unchecked, this damage can become permanent. One of the most frustrating things about dry eye from Sjögren's is that it doesn't always go away with over-the-counter eye drops. In fact, those drops might offer only temporary relief because they don't fix the underlying issue, which is your immune system misfiring. 2. Dry mouth that disrupts your day. This might be why. You wake up in the morning and your mouth feels like cotton. Sipping water doesn't help. You struggle to eat toast or crackers without a drink nearby. Maybe your voice gets hoarse by evening, or you find yourself constantly reaching for gum or lozenges just to keep speaking. If this sounds familiar, it could be more than dehydration or age. It could be one of the most telling signs of Sjögren's syndrome. Dry mouth, or xerostomia, occurs when your body stops producing enough saliva. Saliva does much more than keep your mouth moist. It helps you digest food, protects your teeth from decay, controls bacteria, and even aids in speaking clearly. But in people with Sjögren's, the immune system attacks the salivary glands, slowly reducing their function. Over time, eating, swallowing, and even talking can become uncomfortable and frustrating. What makes Sjögren's related dry mouth different is its persistence. It doesn't go away after a glass of water. It lingers. It can cause bad breath, increase the risk of cavities even in people who've never had dental problems before, and lead to gum infections or tooth loss. For many older adults, these issues come out of nowhere, and the connection to Sjögren's is often missed. You may also notice a change in your sense of taste. Food might seem bland or off. Spicy or salty dishes can become irritating. Dentures may start to feel loose or uncomfortable because of the lack of moisture, leading to more eating difficulties. All of this can have a serious impact, not only on nutrition, but also on confidence and social life. Many people chalk this up to aging, medication side effects, or just getting older. But when dry mouth becomes chronic, and especially when it's paired with dry eyes or fatigue, it's time to look deeper. 3. Chronic fatigue that doesn't go away. Sjögren's could be behind it. There's tired, and then there's this. The kind of exhaustion that sleep doesn't fix. You go to bed early, get 8 hours, and still wake up feeling like you ran a marathon. You move slower, think slower, and everything from brushing your teeth to making breakfast feels like a chore. This isn't laziness. It's not age. And if it's been happening more and more often, it could be a sign of something deeper, chronic fatigue caused by Sjögren's syndrome. Fatigue is one of the most common yet least recognized symptoms of Sjögren's. In fact, for many people, it shows up long before they're ever diagnosed. This isn't just being tired after a long day. It's a deep, bone-heavy weariness that lingers physically, mentally, and emotionally. What makes this kind of fatigue especially frustrating is that it's invisible. You may look fine on the outside, but inside, your body is waging a quiet war. Sjögren's is an autoimmune condition, which means your immune system is attacking your own tissues. This constant, low-level inflammation doesn't just affect your glands, it affects your energy systems too. Your body is using up precious resources trying to defend itself from a threat that isn't really there. This type of fatigue can also make other symptoms worse. When you're tired, your pain threshold drops. You feel drier, more irritated, and less focused. Brain fog sets in. You start forgetting words, misplacing things, or struggling to follow conversations. It becomes harder to enjoy the things you used to love, like reading, walking, or meeting friends, because your energy just isn't there. Sadly, many people over 50 write this off as normal aging. They assume it's part of retirement, menopause, or just slowing down. But when fatigue feels out of proportion to your activity, and when it doesn't go away no matter how well you rest, it's time to pay attention. 4. Joint pain that comes and goes. It might not be aging. You wake up and your fingers feel stiff. It takes a few minutes to uncurl your hands, and even holding a coffee mug feels awkward. By afternoon, your knees ache, or your shoulders feel sore for no clear reason. Some days are better. Other days, the pain seems to flare out of nowhere. Most people chalk this up to arthritis, past injuries, or simply getting older. But for many, this kind of joint pain is actually a hidden symptom of Sjögren's syndrome. Unlike classic osteoarthritis, which tends to affect specific joints over time, Sjögren's related joint pain is more unpredictable. It can move around your body, show up without injury, and often doesn't appear on standard X-rays. The pain may not always come with swelling or redness, but it lingers. It disrupts your routines, your sleep, and your ability to enjoy everyday movement. This joint pain is caused by inflammation. In Sjögren's, the immune system attacks not only moisture-producing glands, but can also trigger inflammation in the joints, similar to what happens in rheumatoid arthritis. The result is discomfort that feels deep and often disproportionate to activity levels. You may notice it most in small joints like the fingers, wrists, or ankles. But over time, larger joints like the knees, hips, or shoulders can also be affected. One of the trickiest parts of this symptom is how inconsistent it can be. You might feel perfectly fine for a week and then wake up one day feeling like you've aged 10 years overnight. That inconsistency makes it easier to ignore or to assume it's just overexertion. But when pain becomes a regular visitor in your life, it's time to ask why. For women over 50, joint pain from Sjögren's is especially easy to miss. Hormonal changes during menopause can also cause aches and stiffness. But when the pain is persistent, shows no clear cause, or comes with other symptoms like fatigue or dry eyes and mouth, it's a clue that something bigger may be happening inside your body. 5. Swollen glands in your face or neck. Don't ignore this sign. You glance in the mirror and notice a puffiness under your jaw, or maybe someone asks if you have the mumps, an awkward question for an adult. The area near your ears feels tender, or your cheeks seem slightly swollen, but you're not sick. No fever, no sore throat. Just this odd, persistent swelling. If this sounds familiar, it might be more than a random infection or dental issue. It could be one of the most revealing signs of Sjögren's syndrome: swollen salivary glands. Salivary glands are located primarily in three places: just in front of the ears, the parotid glands; under the jaw, the submandibular glands; and beneath the tongue, the sublingual glands. These glands are responsible for producing saliva, which keeps your mouth moist, helps you chew and swallow, and protects your teeth. But in Sjögren's syndrome, your immune system begins attacking these very glands. The result? Inflammation, swelling, discomfort that comes and goes. Some people describe a feeling of fullness in the cheeks or under the chin. Others feel tightness or pressure when chewing or talking. Occasionally, the swelling becomes visible subtle at first, but noticeable over time. Unlike swelling from a typical infection, the swelling from Sjögren's tends to be recurring or chronic. It might not come with pain or redness. You may not feel sick at all. That's what makes it easy to overlook. But repeated or long-lasting swelling in these areas is a red flag, especially when combined with other symptoms like dry mouth or dry eyes. In fact, among people eventually diagnosed with Sjögren's, persistent swelling of the parotid glands is one of the most common early signs. It's also one of the most misunderstood. Many patients bounce between dentists, ENT specialists, and general practitioners before anyone considers an autoimmune connection. What makes this symptom particularly important is that salivary gland inflammation can lead to long-term complications. These include reduced saliva production, higher risk of dental infections, blocked ducts, and even rare cases of lymphoma, making early attention essential. 6. Dryness in intimate or skin areas. It's not just aging. Some symptoms are easier to talk about than others, but the truth is, when it comes to autoimmune conditions like Sjögren's syndrome, vaginal dryness and skin dryness are not just side effects of aging. They can be important warning signs that your body is losing moisture in more ways than you think. For many women, especially after menopause, vaginal dryness is already a sensitive issue. It may start gradually with mild irritation, less natural lubrication, or discomfort during intimacy. Over time, it can lead to itching, burning, painful intercourse, or even recurrent urinary tract infections. And while it's tempting to attribute these changes solely to hormonal shifts, Sjögren's adds another layer: the immune system attacking the glands that produce vaginal and mucosal fluids. This dryness doesn't just affect sexual health. It impacts confidence, sleep, relationships, and even day-to-day comfort. And for many women, it becomes a silent struggle rarely discussed, often misunderstood, and frequently untreated. But Sjögren's doesn't stop there. It can also affect the skin. You might notice that your skin feels tight, itchy, or flaky even when the weather isn't cold or dry. Your lips may chap constantly. Moisturizers stop working the way they used to. Some people develop rashes or experience sudden sensitivity to soaps or skincare products they've used for years. Why? Because your sweat and oil glands, just like your tear and salivary glands, can also be impacted by the inflammation caused by Sjögren's. This leads to skin that's more fragile, more reactive, and slower to heal. What seems like a minor irritation can spiral into chronic discomfort or even skin infections. For men, dryness might show up as constant chapped lips, dry patches on the face or scalp, or even cracks on the fingers. While less likely to talk about vaginal dryness, men with Sjögren's can still experience skin-related symptoms that interfere with quality of life and point to deeper autoimmune dysfunction. 7. That nagging cough. Your lungs might be telling a bigger story. You've had a tickle in your throat for weeks, a dry cough that just won't quit. Maybe it gets worse at night. Maybe it shows up after talking too much or in dry weather. You've tried lozenges, humidifiers, even allergy meds, but the cough keeps coming back. Or maybe it's not a cough, but a strange tightness in your chest, shortness of breath when climbing stairs, or a wheezy feeling that lingers. If that sounds familiar, it's time to consider something deeper, because Sjögren's doesn't just dry out your mouth and eyes, it can also affect your lungs. While most people associate Sjögren's with dryness, few realize that this dryness can extend into the respiratory system. Your airways, just like your mouth and eyes, depend on moisture to stay healthy. When the glands that lubricate the lungs and bronchial tubes are damaged by autoimmune inflammation, the result is irritation, dryness, and chronic inflammation of the airways. This can cause a persistent, dry cough, sometimes subtle, sometimes disruptive. It can also trigger a sensation of throat clearing, hoarseness, or vocal fatigue, especially after long conversations or exposure to cold air. Over time, this ongoing irritation can lead to complications like chronic bronchitis, recurrent respiratory infections, or a condition called interstitial lung disease, which causes scarring in the lung tissue and makes breathing harder. Unfortunately, because a cough is such a common symptom, it's often dismissed or misdiagnosed. People assume it's asthma, postnasal drip, reflux, or simply getting older. But in people with Sjögren's, this symptom can quietly grow worse if not addressed, making it all the more important to connect the dots early. Another reason this symptom is so often missed is because many patients with Sjögren's don't realize their autoimmune disease is progressing internally. They may notice a cough or breathlessness, but because it comes on gradually, they adapt avoiding stares, talking less, or blaming it on their weight or age. Ata. Numbness, tingling, or brain fog. Sjögren's might be touching your nerves. Have you ever felt a strange tingling in your feet that wouldn't go away? Or maybe your hands go numb more often than they used to. You might notice a burning sensation in your legs or arms, or a feeling like ants crawling under your skin. And then there's the brain fog, those moments where words slip away, you forget what you were doing, or your thoughts feel like they're moving through molasses. If these sound familiar, they might not be just aging, they could be your nervous system reacting to Sjögren's syndrome. While Sjögren's is most known for affecting moisture-producing glands, its reach can go much further, including into your central and peripheral nervous system. This means it can impact both your brain and the network of nerves that control sensation, movement, and coordination throughout your body. One of the most common neurological complications of Sjögren's is peripheral neuropathy damage to the nerves outside the brain and spinal cord. This can lead to numbness, tingling, burning, or shooting pains, most often in the hands and feet. These symptoms can start subtly and progress slowly, making them easy to dismiss at first. But over time, they can interfere with walking, fine motor skills, and even sleep. Some people also experience problems with balance or coordination. Others might develop issues with muscle weakness or find it harder to perform daily tasks. In more severe cases, inflammation can affect the spinal cord or even mimic symptoms of multiple sclerosis. Then there's the mental side cognitive dysfunction, often called brain fog. People with Sjögren's frequently report difficulty focusing, forgetfulness, and slower mental processing. This can feel incredibly frustrating, especially for individuals who were once sharp, organized, and mentally active. Tasks that once seemed simple, like managing appointments, following a conversation, or planning dinner, suddenly feel overwhelming. 9. Frequent eye infections or light sensitivity. Your vision could be at risk. If you've been battling recurring eye infections, or if bright lights have started to feel unusually harsh, like stepping outside feels blinding, or reading under a lamp becomes uncomfortable, this could be more than just sensitivity. These issues might be your eyes reacting to damage caused by Sjögren's syndrome. As we mentioned earlier, dry eyes are one of the earliest and most common symptoms of Sjögren's. But what many people don't realize is that when your eyes stay dry for too long, they become vulnerable, exposed to damage, infection, and inflammation. The tears your body normally produces contain proteins and enzymes that protect against bacteria and help clear away debris. Without them, the surface of your eye becomes a fragile, unprotected space. This can lead to chronic redness, stinging, a gritty feeling, blurred vision, and most importantly, frequent infections. Some people develop conjunctivitis, or recurring inflammation in the eyelids, blepharitis. Others experience tiny corneal abrasions that become infected because there's not enough tear film to protect the surface of the eye. One major complication that often goes unnoticed is photophobia, or light sensitivity. If you found yourself squinting more than usual in daylight, avoiding fluorescent lighting, or struggling with nighttime glare while driving, It might not just be aging vision, it could be your eyes signaling distress. Photophobia occurs when the cornea becomes inflamed or damaged. In people with Sjögren's, this is often due to prolonged dryness, which leads to tiny cracks or injuries in the eye surface. The result is discomfort, sensitivity to light, and sometimes sharp pain during exposure to even moderate lighting. The problem is, these symptoms can creep in gradually. You may adapt without realizing it, keeping curtains closed, wearing sunglasses indoors, or avoiding night driving altogether. But none of that addresses the root issue. If left unmanaged, these eye complications can progress to corneal ulcers, scarring, or even vision loss. And because the eyes are one of the few organs that show obvious external symptoms, they often serve as an early and urgent clue that something deeper is going wrong in the immune system. 10. Feeling mentally foggy or forgetful. Don't just blame aging. You walk into a room and forget why you came. You search for words mid-sentence. Simple tasks like managing bills, cooking dinner, or following a conversation feel harder than they used to. You might even feel like your mind is wrapped in a heavy cloud, slowing your thoughts and stealing your focus. This isn't just getting older. For many people with Sjögren's syndrome, this frustrating symptom has a name: brain fog. Unlike temporary forgetfulness, Sjögren's related brain fog is persistent. It can affect memory, attention span, mental clarity, and processing speed. One day you feel sharp, the next you're struggling to keep up with even the most basic tasks. It's unsettling, especially for those who've always prided themselves on being organized, articulate, and mentally quick. This fog doesn't come from nowhere. Sjögren's is an autoimmune disease that causes widespread inflammation, and the brain is no exception. Inflammation in the central nervous system can disrupt how signals travel in the brain. That means even if your physical symptoms are manageable, the cognitive effects can leave you feeling disconnected, unmotivated, or emotionally drained. Another contributing factor: sleep disruption and chronic fatigue. Many people with Sjögren's have trouble sleeping due to pain, dryness, or nighttime coughing. And when the brain is sleep-deprived and tired, cognitive function suffers even more. Add in hormonal changes, medications, or stress from managing a chronic illness, and it's no surprise your brain might feel overwhelmed. Some describe it as feeling mentally underwater. Others say they feel detached, as if they're watching life happen around them, but can't fully engage. This isn't just frustrating, it can be scary, especially when it affects decision-making, work performance, or relationships. What makes this symptom especially dangerous is that it's often dismissed. Doctors may say it's just stress. Family may assume you're just tired, and you might start to believe that too. But when brain fog becomes a pattern, when it's interfering with your daily life, it deserves attention. The key is connecting the dots. If your brain fog is showing up alongside other signs like dry eyes, joint pain, or numbness, then it's no longer an isolated issue. It's part of a bigger picture that may point to Sjögren's black. Sjögren's syndrome is called a silent disease for a reason. It doesn't come crashing into your life overnight. It tiptoes in, disguised as everyday annoyances, dry eyes, a little fatigue, maybe some stiffness in your hands. But over time, these small symptoms can turn into life-altering complications if left unrecognized and untreated. The good news? You now know what to look for. Whether you've checked off one symptom on this list or several, awareness is your first line of defense. Talk to your doctor. Ask the questions. Don't settle for vague answers when your body is clearly speaking up. The earlier you get a diagnosis, the sooner you can protect your eyes, joints, nerves, lungs, and your peace of mind. And if this video helped connect the dots for you, consider it a starting point, not the end. At Active Healthcare, we're here to make complex health topics clear, especially for those of us navigating health over 50. Our goal is to give you practical, powerful knowledge without the overwhelm. So, if you haven't already, hit that subscribe button. Join a growing community of proactive people who believe aging should be empowering, not confusing. Thank you for watching, and as always, take good care of yourself. You deserve it.